Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute of Orthopedic Surgery. I want to talk to you about selective nerve blocks. These are for hand-wrist surgery, generally single shots, and they're done for your postoperative pain management. Members of the team that you may have already met is first the SBA, or Special Block Assistant. She will be positioning, prepping, and assisting in the procedure. She will monitor you before, during, and after the block, and she will also help you with any comfort issues. Next, you will likely be meeting an anesthesia provider. This will be the person that will take you to the operating room, get you off to sleep, monitor you very carefully, be waking you up, and taking you to our recovery room. These procedures have been designed foremost with your comfort and safety in mind. The nerves to the hand-wrist area are blocked in the forearm area. This is a very simple procedure. Will take less than 5 minutes to complete, and the block will last 12 to 24 hours. The area will be prepped. An ultrasound probe will be placed over the nerves. The ultrasound machine allows us to see the nerves underneath your skin. This is extremely helpful. We will then take a very small numbing needle and will numb up your skin. Then, a special block needle is placed through the numb skin and is directed to the proper location under ultrasonic guidance. Medication is injected. We watch it surround the nerves. Once that's been accomplished, we remove the needle, and then we're done. The area of numbness depends on which nerves we block, the median nerve or the ulnar nerve. It depends on your surgical site. Don't worry, we'll block the correct nerves. You will notice that your hand gets extremely warm and may feel heavy, tingling. You still will be able to move your hand. And remember, this is all temporary and will last about 12 to 24 hours. Be extremely careful with your numb arm and hand. Protect your blocked extremity from excessive heat, sharp objects, hard or pointed surface, and unless directed otherwise, keep your arm and hand in a sling. The benefits of the block extend into the operating room. Generally, you require less anesthesia and pain medications during the operation. You may be able to have the operation with the block only. Generally, you wake up with less opportunity for nausea, vomiting, and you have significantly less pain postoperatively. You will be provided with a prescription for pain medications. Start your pain medication prior to the block resolving. You will receive specific recommendations at discharge. Anytime we place a needle in anybody for any reason at all, there is a small amount of risk. This includes damage to surrounding structures, veins, arteries, nerves, muscles, also risk of medication reaction, also the small possibility of infection. But this is why we use an ultrasound machine, specially designed needles, injection techniques, and we monitor you carefully during and after the procedure. A few housekeeping items. Your guests will be asked to leave before we get started. We'll be bringing in our equipment, ultrasound machines. You will be hooked up to monitors, EKG, finger clip, and blood pressure cuff. We understand if you're nervous. That's perfectly normal. We're going to take great care of you. Generally, your nurse will provide you with a light dose of sedation, which is roughly equal to 2 drinks or 2 Bud Lights. This is given before your procedure through established IVs. I'll be in shortly. There will be plenty of time for questions. If you have any questions, please don't hesitate to ask. That's what I'm here for. Thank you for your attention.